Calling the HHS calendar for 101 hearing for DM of SB 1163.
33, Senator.
1633.
Excuse me, as 1633. For SB 1633, while we await the AEN chair's notes on the DM, we're gonna roll that calendar to the end of this calendar, which would be 1:30.
At 1:20, Senator.
No, 1:20 is, we have 1:20 calendar. So we'll roll the DM to 1:30 today. Okay? With that, we are in recess. And what's my next one? 105. Calling the 110 calendar of the joint session of Health, Human Services, and Labor. LBT is labor?
Yes.
Okay, sorry, Labor and Technology. I'm trying to figure out what the T stood for. This meeting is being streamed live on YouTube. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business on Wednesday, February 12th, 2025 at 1 p.m. in room 225. For those on Zoom, your audio will be muted and video disabled until shortly before it's your turn to testify. Each testifier will have 1 minute to testify. If there's a technical glitch during your time to testify, we may have to move on to the next person due to time constraints. I will be reading a list of individuals who submitted written testimony for each measure. We apologize if the closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislature's website. You will find a link on the status page for the measure. We appreciate your understanding and remind you that the committee does have your testimony, that I reviewed them, so I encourage you to use your time to either add additional comments or stand on your written testimony. First up, SB 447 relating to Department of Health pilot program. We have Department of Health in support.
Chair will stand on our testimony.
Okay, thank you very much. Next, we have Department of Human Resources Development providing comments. Yes.
Hi, chairs. Good afternoon. I'm Brana Hashimoto, Director of the Department of Human Resources Development. We're providing comments on this measure. However, I just wanted to point out a couple of things. First of all, DEFER currently has 3 different forms of delegation available to departments if they would like to take on recruitment functions. However, each of the delegations that we do offer, we do require that they comply with all of our civil service rules, policies, procedures, statutes, collective bargaining agreements, and all of that. And we do have concerns about some of the provisions in this delegation that do not comply with civil service.
Okay, thank you very much. Next, we have Randy Pereira, Hawaii Government Employees Association, providing comments. Next, we have Don Poyani in opposition, and then Ellen Owai in support. Anybody else wishing to testify on SB 447? Seeing none, members, any questions?
Chair, I do.
Okay, Senator Moriwaki,
thank
please
you.
proceed.
So the Department of Health did do a pilot. Is that what I understand from your testimony? Oh, it's the Department of Health.
Come on up.
Hi, Director. So you did have a pilot that did all of these things that you say in the bill, or what was stated in the bill?
Aloha, Kenny Fink with the Department of Health. Thank you for the question. We did a pilot with one aspect of what is in the bill, and that was the process by which for the classifications that are unique to the department and those for which we're able to have delegated, all we did was, instead of reviewing minimum qualifications at the time of application, we reviewed it for all the applicants and delaying that time to generate a list. We took all applicants and sent them to the program to review. And then when they selected an individual, we just reviewed the minimum qualifications for that one individual. So that was fully compliant with the outcome, that the person was qualified before an offer was made, and that streamlined the process significantly. We avoided well over 100 applicants whose minimum qualifications would otherwise have been reviewed, allowing our recruitment staff to focus on other recruitment efforts.
So what the HRD director is saying is that some of the proposals in this bill are not in compliance, but you're saying that what you have done is sufficient, or you're adding all of these other requirements that you see that HRD may have some concerns about?
The pilot includes other strategies as well that we have not yet tested, some of which additional authority would be required. I think every system is perfectly designed to achieve its results. And a government job today, unfortunately, is not as attractive or competitive. So I fully respect the merit principle, but when we have more jobs than applicants, selecting one position is not taking an opportunity away from anyone else if they're qualified. So we're seeking the opportunity. We feel there's a need to innovate, and happy to be laboratory to see what would work within certain guardrails, to see if it's scalable, provided that it does not impact, again, other people's opportunities or conflict with the intent of the merit principle.
So you are okay with restricting or taking out those things that HRD finds that may not be going with the merit principle, or opening it up for all comers, I guess?
We'd welcome the conversation to have a better understanding of what is required by the law versus policy. And again, see if there's an opportunity to try different things and seek efficiency within the process. Like other departments, we have a 30% vacancy rate. Unlike other departments, in a recent OWR survey, 43% of those who responded said they were looking for a job in the next 12 months. Okay, I have a sense of urgency to be able to continue to do the core functions of our department. If people start leaving, there will be a downward spiral, and I'm doing my best to keep the folks that we have and try and fill the vacancies as soon as we can. I fear that there's the risk of another pandemic, and if I start losing staff, our ability to respond to protect the public will be challenged, difficult. So I just want to clearly communicate I'm acting out of a sense of urgency.
So we understand that, and we'd like to support that, but I think in terms of looking at what is consistent application across the board, and maybe you have unique classes that could be addressed in that way. I'm just wondering, have you talked with HRD to see how you can streamline whatever you need to have done so that your urgent classes can be open and you can recruit and get people?
I appreciate that Deputy Director has been available, and I've engaged with him on conversations. I do believe we should be seeking efficiencies in reviewing how our processes go. In that, where he had offered their Wiki program as an option for delegation, and to me, that doesn't reduce steps. So I wasn't clear about that. But I'm trying to keep an open mind and see where we can work together. I asked for a certain service level, that if there was a commitment to be able to verify minimum qualifications, and even in less than the time we're able to do that now. So if there's a commitment to meet a certain service level, that would be okay. And if they're not able to, I'd welcome the flexibility for us to try.
I guess that what I've seen in the testimony from HRD is that you can already do these things that are already delegatable.
So the challenge with the HOLO program is that it just delegates the process as it exists with no efficiency. So we, from my perspective, we end up doing the work, but then we still have to go back to DHERT for their final approval. So there's no efficiency gained in that. It's just a change in who does the work. What I would like to do is, in the spirit of the HOLO program, let us do it in the way we did our pilot program that seems to be working. So we actually can take on that responsibility, but be allowed to have a more efficient process so it's more timely. And And then there are certain things that I think are helpful that for the temporary assignment off the list. Every step, every transaction, someone has to touch and it takes time. So it's work for an individual and it causes delay. When people are applying for a job, they need a job now. So if it looks like all of our TOALs are getting approved, then is it possible, we've shown in good faith we're doing it correctly, let us send you a list for the previous month so you can check, but it won't delay the process. And if it turns out you're saying in basically retrospective review, it's not working, fine, we lose the privilege. But we're just asking for some flexibility based on our record that we can try to do things differently because I believe the system itself needs to change.
Thank you.
Okay, thank you very much. And I'd like to note that the bill is only for pilot program that for 3 years, it appears, 2028 until 2029.
We're just trying to
understand.
experiment, and again, I respect DHER trying to problem solve with us. They're important colleagues, and we hope we can, it's, I think, difficult to do things statewide, so I'm hoping we can try things and see and learn from it. And frankly, I'm more afraid of not trying than failing.
Okay, so I want to do a follow-up question with what Senator Moriwaki pointed out, and that is one of the reasons I've scheduled this bill for hearing is because I remember at the time of your appointment, I had spoken to you and your first deputy as to what avenues you have dealt with DHER on recruitment, because the vacancies with Department of Health even predated your appointment, correct?
Yeah.
So have you made those, and at that time, you had assured me that you are trying to have these efficient recruitment processes through DHER. Has that helped in your recruitment? Have those avenues that you have been trying to work with DHER, has that helped in any way reduce your long-term vacancies?
So our vacancy rate in total has not decreased much, okay? It has not decreased significantly. But we have a lot of retirees. With an aging workforce, we have to work harder to keep up. So what we did find through this hire project, on average, from when the recruitment closed, not to getting a list, but from the recruitment closed to making an offer, right, is now about 53 days. So that's really pretty significant for someone who's looking for a job. And for someone who's looking for a government job, we have to really remove all barriers for anyone who's willing to come work for us.
Okay, and I'd also like to point out that HGA has put down, has submitted written testimony conditionally supportive of this pilot program. Thank you.
Thank you.
Any other comments, questions, concerns?
Chair, one more question for DHRD Director. Hi, Director. You said you had some concerns about this bill. Is there anything glaring there that you would want to see amended so that we can try this pilot? Because I think what the director is saying is that they have needs urgent and they want to move faster. But so if this is a pilot for 3 years, as the chair says, I mean, I see, trying different modes of getting our vacancies filled. But if there is anything glaring that you see in this bill.
So thanks for the question. And from DHER's perspective, we're sympathetic. I spent many years at the Department of Health. I have a soft spot for the Department of Health. And we're willing to work with them to come up with a plan that is flexible, that is timely, that does meet their needs. And so from our perspective, I think you heard Director Fink talk about WikiWiki, which is a tremendous workload for both sides. DHER commits to reviewing applications for those classes that we put into WikiWiki every 2 weeks. So anybody that's applied, we turn them around within 2 weeks. And that's our commitment. Those applications then go directly to the managers, which I think is part of Dr. Fink's concern, trying to eliminate unnecessary steps. So the beauty of WikiWiki is that it goes directly to the managers, and then they can, and we also let the applicants know, if you're interested in this line of work, call these people and schedule the interview. We send out the notices directly to the applicant, so there's actually no need for a list, but the department can also get a list and contact those individuals immediately. So we've given them some options. What I have concerns about with the way that this bill is, and it does differ from what they're doing now in some very important aspects. I think right now the concern that we have with what they're doing is that they're not giving all applicants their due process rights, which is required under our administrative rules. So every applicant has the right to be advised whether they meet or don't meet the minimum qualification requirements. And if they're deemed to have not met, they have the ability to file an internal complaint and to pursue that through the Merit Appeals Board. And that is not happening now. And that is a tremendous concern with what Department of Health is doing on their pilot currently. In this bill, it not only expands it, but it also delves into two other areas, which I find very problematic. The first of which is that they unilaterally can change the minimum qualification requirements, which is problematic. We have a civil service system that's rooted in our Constitution. It's rooted in Chapter 76. We have a classification and compensation plan, which recognizes the duties and responsibilities of all civil service jobs and pays them equitably. We have equal pay for equal work statutes, and for them to unilaterally change the minimum qualification requirements, and also in section 4, it allows them to make an appointment at any step on the pay scale, which violates our equal pay for equal work and our policies and procedures that we've consulted with the union on how pay is administered. So those are two very significant changes that are not part of the delegation that they're currently operating under, which I find very problematic. And like I said, we have the Act 2186, which the legislature just passed last year, that they can avail themselves of if they want to have additional delegations. I think there are time limits for DEFER to respond within that bill. So it's not as if we are going to hold them up. If Dr. Fink wanted to, ask us to review them within, I think the bill says maybe within 5 days or less, 3 days. If it's an urgent matter, we can work on that and get him a decision very quickly. The HOLO delegation, actually, I think you heard him mention HOLO delegation. That one is, they do the minimum qualification
So
requirements.
I really want to keep you guys down to
Okay.
1 minute, and I know, any other
No,
questions?
no, I just wanted to know what was problematic.
Okay, thank you. Thank you very much. Okay, moving on, SB 1043. First up, Department of Taxation providing comments.
Aloha, chairs, vice chairs, chairs of the Department of Taxation. The department will stand up for testimony providing comments on administration.
Next, Hawaii Children's Action Network speaks, providing comments on Zoom. Nicole Wu, you have 1 minute.
Sorry, I was just trying to get my microphone undone. Hi, chairs, vice chairs, members of the committee. I think we all agree on the tax equity that this bill intends to provide. And we support certain parts that reduce the tax burden, especially on lower income families. But the big question is who should pay for it? The GET increase that's in this bill would make everything in the state more expensive. Every item, every service. It's a 50% increase in the GET. We know that's especially hard on low income and working class people. There are other types of revenues that hit non-residents a lot harder and target them better than the GET. So we're really happy to have more extensive talks about the best way to provide tax equity and help with the cost of living, but we don't think the GET is the way to go. Thank you.
Okay, thank you very much. Devin Thomas, Hawaii Appleseed Center for Law and Economic Justice, providing comments.
Good afternoon, Chair, Vice Chair, members of the committee. Thank you for the opportunity to testify today, providing comments on this bill. We, again, along with Nicole from HCAN, agree with the intent of the bill to provide tax relief to low-income households, especially those under the ALICE threshold. However, we think that it's hard to evaluate the net impact of this bill because we don't have fiscal notes in the state, number one. And it's with the number of measures in here, it's difficult to really provide a comprehensive, really reasoned analysis of this. But We agree that the general excise tax is a regressive tax, and to raise it would impose more undue burden on working class families. That's the provision that we disagree with in this bill. We urge the committee to keep the conversation going around tax credits in general. The earned income tax credit is another great way to deliver benefits to working families that need relief right now. Thank you.
Thank you very much. Next, we have Iron Workers Stabilization Fund in support.
Good afternoon, Chair, Vice Chair, members of the committee. My name is Cody Sula with the Iron Workers Stabilization Fund. On behalf of our Managing Director, T. George Paris, we'd like to strongly support our SB 1043 relating to taxation. We know that this bill represents a crucial step towards the financial, towards reducing the financial burden, promoting recovery, economic stability during the difficult time for Hawaii's residents. We know that a lot of residents are struggling. We have a steady decrease in population since 2016. And with the Income Coalition's Out of Reach 2023 report says that the average worker got to work 100 hours per week to afford a one-bedroom rental at fair market prices. For a two-bedroom residence, you got to have an hourly wage for at least $44.60. A couple of things in our testimony, we just want to highlight a few of the main points that we believe that this bill can do to alleviate the tax burden and enhance economic equity. Is exempting groceries and non-prescription drugs for from the GET. Also removing tax liability on the first $100,000 for individual incomes, and also $200,000 for couples. Unemployment and.
Okay, thank you very
Okay,
much.
Thank you.
Next,
Bye.
we have Tom Yamachika, Tax Foundation of Hawaii, providing comments. Tom Yamachika.
Thank you, Chair, Vice Chair, members of the committees. Tom Yamachika from Tax Foundation of Hawaii. We have submitted written comments. I call this bill Candy Crush because it has some sweet things in it, but does have the potential to decimate the economy. We are most concerned about the bill undoing most of the Act 46 cuts from last session and raising the GET by 50%. More details are in my testimony. I'll be happy to answer any questions.
Okay, thank you very much. Next, we have Michael Yadao, OPC MIA, in support.
Chair, Vice Chairs, thank you, Mike Yadao from Local 630, the Operative Plasters and Cement Masons International Association. You have our written testimony, but we just wanted to highlight that we don't normally comment on matters that are not directly construction related, but we do feel that there is a construction nexus and that working families are leaving Hawaii in droves, and we're facing large projected worker shortages. And so any measure that alleviates some of that suffering and some of that burden on working families, we are in whole support of, and we believe this measure does.
Okay, thank you very much. Next, we have HSTA in support. Osa Tui, are you present on Zoom? Okay. IT, is Osa Tui present on Zoom?
Not present on Zoom, Chair.
Okay, next, Grassroots Institute of Hawaii, providing comments. Anna Tuayosopo for Operating Engineers Local 3 in support. Ikaika Castillo, Hawaii Masons Union Local 1 in support. Lauren Zerval, Hawaii Food Industry Association in support. Dwayne Bautista, Iron Workers Stabilization Fund Local 625 in support.
I'm on Zoom. Can you hear me? Hi.
Okay, why don't you wait a second? Let's Dwayne Bautista speak, and then you can come in, Lauren.
Good morning, Chair, Vice Chair, and committee members. My name is Dwayne Bautista, and I work for the Iron Workers Stabilization Fund under the direction of our Managing Director, T. George Paris. I'll summarize our my written statement with the four things that we asked to support on Senate Bill 1043. As you know, eliminate the GET taxes, prescription drugs and over-the-counter, removes tax liability, increases the tax rent credit, and establish the Maui Fund. The reason for these things right now, the way Hawaii is going, we need some new money. what's going on right now, take away the unemployment insurance, people who's not going to be working. Now they have a chance to have money in their pocket without, with having the uninsurance tax off. And then as for the liability, you're gonna have money again inside your pocket. If not, everybody's gonna stop moving out. The gentleman earlier talked about on his part, people's
Okay.
moving out. That's what we wanna do, keep Hawaii home.
Thank you.
And something for us. Thank you.
Thank you very much. Okay, Lauren Zerbel, you're on Zoom. Please proceed.
Thank you so much, Chair. We submitted comments in support with amendments. We strongly support removing groceries from the GET. There are many, many studies that show that there's a strong causal relationship between grocery taxes and food insecurity. 1 in 3 individuals in our state struggles with food insecurity, and that number increases to 40% on Hawaii Island, which I hope we all can agree is completely unacceptable. We should do everything possible to eliminate food insecurity in our state. In my very long testimony, I actually put together what I believe it would actually cost if you were to, do a dollar for dollar. It'd be about $256 million to remove SNAP eligible groceries. And we got there from 2 different angles, and we got a pretty similar number. So one was using the USDA take home food budget, and the other was by, using the Thrifty Food Plan budget times our population. And actually the numbers were very similar, which indicates that the majority of take home food is purchased.
Okay, thank you, Lauren.
Okay, thank you.
Thank you very much. Okay, next we have Lynn Akatsuka providing comments, Ellen Awai in support, Mary Kawasaki in support, Kayla Marie in opposition, Don Buluyan in opposition, D.A. McClintock in support, Lokelani Camaros in support, Nicola Zer in opposition, Natalie Iwasik providing comments, Mel Kahele in support. Anybody else wishing to testify on SB 1040P? Come on up.
Yes, Senator, I just want you to add to my testimony.
Yeah, identify yourself.
My name is Mel Kahele. I'm with the Iron Workers, but I'm going to speak on behalf of me being an affected parent, grandparent, and a taxpayer. Some people are good with it, some people are not too good with it, but at least we've started a conversation. I believe the senators should look seriously at what stuff we got in this bill. And, I'm not going to mention all the stuff that was already mentioned by the prior testifiers, but we need to find a way to try to keep our families home. We're going to be paying an additional 2% over the 4 years or at the fourth year of this bill, but at least we're going to be looking at saving money on the first $100,000 that we're going to be making on income. We get unemployment, insurance, taxes that we now not going to be looking at paying, but find a way to try to keep our native Hawaiians and our people that lives in Hawaii here.
Okay.
We got more people living on a big island up in the mainland than Hawaii.
Thank
So
you, Mr. Kahele.
keep the conversation going. Thank you, senators.
Okay, thank you very much. Okay, anybody else wishing to testify? Come on up.
Hello, everyone. My name is Scotty Rees-Moniz. I'm with Waimanalo, Friends of Waimanalo Workforce Development. We train and certify men and women in getting a better position when they're going out for getting jobs in forklift, grader, scissors lift, and we send them all to the unions. We want to strengthen our people out here. However, I've been working closely with one of the largest employees, Hawaiian Electric. They've been having an exodus from ages 21 to 35. My nephew is one of them, my daughter is one of them, and they don't even know the language. They don't know the culture. They lost it. So what we're trying to say is if we can take time to be in support of this and start working forward to bringing solutions, we feel that this actually going to bring one in a right direction to keeping our people here. Keeping them here because a lot of the times they're only saying, my money is going further every place else. And that's what we're trying to bring them so they can stay here in Hawaii.
Okay, thank you very much. Okay, anybody else? Come on up.
Good afternoon, Chair. San Buenaventura, Chair. Aquino, Gino Suquena. I'm the Executive Director of the Hawaii, members of the committee, sorry. Gino Suquena, Executive Director of the Hawaii Building Construction Trades Council, which represents 18 construction trade unions here in the state of Hawaii. Although we normally come and testify on construction and labor issues, this issue is very important to us because it is not only affecting the residents, but also our members. And the Hawaii Building Construction Trades Council is committed to finding and working for solutions to combat this issue. We just ask that you guys pass the bill out to continue further the discussion. Thank you.
Thank you very much. Come on up, identify yourself.
Aloha chairs, vice chairs, members of the committees. Tuiana Scanlon, president of IATSE Local 665, IATSE International Trustee. Apologies for submitting late testimony, but we stand in our written testimony in support and urge you to continue the conversation on this bill. Thank you.
Thank you very much.
Good afternoon, Chair, Vice Chair, and committee members. My name is Cliff LeBoys. I'm with the Iron Workers 625 Stabilization Fund under the direction of T. George Paris. I just want to share with you the number of support we have out there for this bill, which we talked to at least 1,500 families. They all support, like the idea. They want to know more about it, learn more about it, but just so that you understand what's in back of us. We have the following unions: electrical, elevators, plaster and cement masons, insulators, bricklayers, plumbers, sheet metal, Hawaii Teamsters, IBEW, Boilermakers, ironworkers, painters, glaciers, floor layers, drywall tapers, roofers, and operating engineers. Total, we're talking about 35,000 members, which would equate, when you add in the rest of the family members and relatives, over 140,000 people that we could have had here today to testify on this bill. We couldn't all bring them all in here, you all know that, but we have a very, very strong support out there in the communities for this bill. We urge you, if anything, to just keep this bill moving for further discussions. We know there's things that we can probably change or add, but this is something that the community, the state, the workers in the state of Hawaii needs to be done. They need help. They need help. We thank you for the time to testify. Thank you very much.
Okay, thank you very much. Anybody else wishing to testify on SB 1143? Seeing none, 1043. Seeing none, members, any questions? Seeing none, are we ready for decision making or do we need to recess? Okay, recess for decision making. Calling back the joint HHS-LBT calendar for 120 calendar for decision making. First up, for SB 447, Chair's recommendation is to pass this as is. We note that this is that the Department of Health has had a long-term vacancy problem. We're now faced with an avian flu. We cannot, they have been decimated after the COVID-19 pandemic. We cannot have a more decimated Department of Health facing a potential pandemic. So any comments, questions, concerns, as is? Vice Chair for the vote. Chair votes aye.
Thank you, Chair. Voting on Senate Bill 447, recommendation of the chair is to pass as is. Chair and Vice Chair vote aye. Senator Hashimoto. Aye. Senator Keokalole is excused. Senator Favela. Aye. Recommendation is adopted, Chair.
Thank you. For SB 1040.
Sorry, Chair. For Labor and Technology, same recommendation.
Voting on Senate Bill 447, recommendation to pass unamended. Chair and Vice Chair vote aye. Senator Ihara. Aye. Senator Moriwaki. Aye. And Senator Favela. Aye. Chair, the recommendation is adopted.
Okay, thank you very much. So for SB 1043, Chair's recommendation is to pass this with substantial amendments. We're going to delete everything except for Section 2. We're going to put in a defective date of December 31, 2050. We would like to note that the House bill version of this died in committee. So the high likelihood is it's not going to pass this year, but we are heedful of the fact that the conversation needs to continue. We also would like the proponents, for anything substantial like this, we need to know the fiscal impact, and there is no report as to the fiscal impact to the state. So with those amendments, any comments, questions, concerns? Keeping section 2 defective date, deleting all else. Seeing none, Vice Chair for the vote.
Okay, voting on Senate Bill 1043, recommendation of the chairs to pass with amendments. Noting the excused absence of Senator Keokalole. Any reservations? Any noes? Recommendation is adopted, Chair.
And with that, we are. Oh, sorry, LBT.
Labor and Technology, same recommendations. Any questions or concerns? Seeing none, Vice Chair for the vote, please.
Voting on Senate Bill 1043, recommendation to pass with amendments, noting all committee members present. Are there any reservations or noes? Seeing none, the recommendation is adopted.
Okay, we are going to adjourn the joint committee, but I'm going to recall the decision-making for SB 1633 for HHS only. For the decision-making for SB 1633, Chair is going to follow AEN Chair's recommendation, in which is to defer it again to Wednesday, February 12th, 1:30 p.m. at room 225. Any other comments, questions, concerns? Seeing none. And with that, we are adjourned for HHS 120 and 101 calendar and 130 calendar. Calling the single HHS calendar for 1:20 p.m. The same colloquy said earlier is going to be summarized. Basically, in the unlikely event we have to abruptly end this hearing due to technical difficulties, committee will reconvene to discuss any outstanding business February 12th at 1 p.m. at room 225. For those on Zoom, audio will be muted, video disabled until shortly before it's your turn to testify. Each testifier will have 1 minute to testify. We have a substantial calendar. So please be mindful of your time. If you've already provided written testimony, please stand on that unless you want to add to it or amend it. First up, SB 298 relating to human services. We have Director Yamane providing comments.
Honorable Chair, members of the committee, on behalf of Director Yamane and the Department of Human Services, we stand on our written testimony, appreciating the intent, offering comments, and requesting an amendment. Thank you.
Thank you. Next up, Hawaii State Council on Developmental Disabilities and Support. Thank you very much. Nancy Moser in support, Kate O'Connor in support. Anybody else wishing to testify on SB 298? Members, any questions? Seeing none, moving on. SB 299 relating to loan repayment for healthcare. First up, we have Department of Health in support. Okay, you got two Department of Health people.
They really support.
They really support. Will Kane, Senior Advisor, Office of the Governor in support. Jack Liu and Hawaii State Health Planning Development Agency in support. Thank you, Dr. Lewin. Next, Laura Reichart, Hawaii State Center for Nursing in support. Are you present, Laura, on Zoom?
Not present on Zoom, Chair.
Okay. Kelly Whitty, University of Hawaii System in support. Thank you very much. J.C. McCulloch, Queens Health Systems in support. Jonathan Ching, Kaiser Permanente in support. Thank you. HMSA in support. Thank you. Healthcare Association Hawaii in support. Thank you. Jeremy Crickmore, Hawaii Association of Professional Nurses in support. Jeremy, are you present on Zoom?
Not present on Zoom, Chair.
Thank you. Eric Abe, Hawaii Primary Care Association in support. Hawaii Medical Association in support. Alan Johnson, support. Hawaii American Nurses Association again in support. Hawaii Pacific Health in support. Hawaii Dental Association support. Hawaii Association of Health Plans in support. Rachel Wilkinson. Thank you very much. Bronson Silva, Democratic Party of Hawaii in support. Aloha Care in support. Mike Nguyen, are you present on Zoom?
Not present on Zoom, Chair.
Okay, Joseph Meyer in support. Joseph?
Yes.
Couple comments real quick, given the fact that the first program increased 73.
You need to come up, Joseph, and identify yourself. You have 1 minute.
30 seconds.
52 seconds. Come on up.
Given that the first year of the program added 73 healthcare providers, 55
You
full-time
need to
equivalents.
identify yourself.
Joseph Mayer.
Thank you. Okay,
On a budget of 30 million, current statistics shortages, 543 full-time equivalents, 10 times the first-year recruiting. National physician shortage is expected to double in 8 years. Nationally, as of 23, 22% of physicians are over 65 years of age. Currently, 50% of physicians over 55 are considering retirement. Given the documented need, the last year's $30 million netted 73 providers, 10% of the need. What is the rationale for cutting the appropriations in half? Thank you.
okay, thank you very much. Next, we have Jermaine Kaulula'au in support, Rick Ramirez in support, Lynn Murakami Akatsuka in support, Jency Melemai Watson in support, Avery Olson in support. Anybody else wishing to testify on SB 299? Members, any questions? Okay, seeing none, moving on. SB 322, relating to Medicaid. First up, we have Director Yamane, DHS, in providing comments.
Aloha, we stand on written testimony, offering comments and requesting an amendment.
Thank you very much. Next, Audrey Suga Nakagawa, AARP, in support.
We stand on our testimony in support. Thank you.
Thank you very much. Kylie, in support. Are you present, Kylie, on Zoom?
Not present on Zoom, Chair.
Nancy Moser, in support. Anybody else wishing to testify on SB 322? Members, okay, come on up. Identify yourself.
Hi, my name is Shell. I'm a full-time caregiver. And I'm not used to being here, and I actually have 7 pages of testimony, but since I only have 1 minute, I'll get to the point.
Thank you.
So where does the state get the money to pay for our rates? The simplest answer to that is take it from the fund that the state saved from utilizing the foster care home industry, which is not complicated at all. You just need to appropriate funds appropriately to the initiatives that saves and makes you money. The CCFFH saves you $300 million a year, and you take the $35 million that we need to fund the high option rates that will fund our livelihoods, then you still get $200+ million for yourself, for the state. And there is a difference between the state and the federal funding. And per Dr. Yamani's testimony, the state only needs $14 million to fund the high rate option for the CCFFH. That's even a no-brainer. Because if the CCFFH saves you $300 million a year and you pay us the high option per minimum rate, it still saves the states $286 million. So now that we have the $14 million to raise.
Thank you.
Okay, I'll get to the big point.
And yes, we already know that. Everyone is in support. I'm just letting you know.
Good.
There's no one in opposition.
Okay, so now one of the solution is, why don't we keep in line with the federal Medicaid policy? I'm not a politician, of course, and I'm not very, I don't know a lot about this, but I do know that Hawaii's reimbursement policies disproportionately support institutional care, violating federal laws that require states to prioritize HCBS expansion and ensure patient choice. Several federal policy
Okay,
and
thank
guidelines.
you very much.
Okay,
Sorry.
thank you. That's
Okay,
okay.
next up, we have anybody else wishing to testify on SB 322? Seeing none, members, any questions? Okay, SB 323, relating to mental health. First up, Behavioral Health Administration providing comments, Hawaii Department of Health. Next, we have Alan Johnson of HSAC in support, J.C. Mikulinek, Queens Health Systems in opposition, Randy Pereira, HGA in opposition, Veronica Moore in opposition. Anybody else wishing to testify on SB 322? Sorry, 323. Nobody else. Okay, members, any questions? No. SB 324, relating to pharmacists. First up, Director Yamane providing comments.
Aloha, we stand on written testimony, offering comments, and also requesting amendments. Thank you.
Okay, thank you very much. Next, we have Insurance Division, State DCCA providing comments. Office of the Auditor providing comments. Don Carisu, HMSA, providing comments. Thank you. James Kizuski, Board of Pharmacy, in support. Thank you. Corey Sanders, Hawaii Pharmacists Association, in support. Corey, are you present on Zoom? You have 1 minute.
I'm here. We'll stand on our written testimony. I'll stand by for questions.
Thank you. Queens Health Systems, in support. JC.
Stand our testimony.
Eric Abe, Hawaii Primary Care Association, in support. Hawaii Pacific Health, Michael Robinson, support. Grassroots Institute of Hawaii, in support. Tiffany Yajima, Shanghai Walgreens Company, in support. Rachel Wilkinson,
Hi,
Hawaii Association of Health Plans.
Hi, sorry.
Rachel, please
Hi, sorry.
proceed.
This is Mihoko Ito on behalf of Walgreens. Just wanted to note that we stand on our testimony and support and request some amendments to the bill. Thank you.
Okay, you didn't register on Zoom, otherwise you'd have been called. Okay, no problem. Thank you. Rachel Wilkinson. Thank you very much. Alisa Lavoy, in support. Michael Silva, in support. Ronald Taniguchi, pharmacist, in support. Melissa Boomgarden, in support. Melissa, are you present on Zoom?
Yes,
Okay,
thank you
please
so
proceed.
much. Thank you, Chair, Vice Chair Committee, for the opportunity to speak. I just wanted to share some additional comments. I stand on my written testimony. As of 2024, there were 34 states that allowed pharmacists to be compensated for services, in addition to 3 other states that paid for Medicaid directly. This year is my 30th year, serving my community in pharmacy in some capacity with 25 years as a pharmacist, and I've been licensed in 6 states. And Hawaii is the only state in which I cannot bill for the services I provide that go beyond giving medications to a patient in a bottle. So pharmacists have made great advancements in what we do in collaborating with other providers. And our patient interactions, while they're collaborative in nature, often occur independent of the time that the patient spends with the provider in the room. So I'm honored and humbled to have been recognized as a provider amongst my peers and my colleagues last year by the Hawaii Primary Care Association as Healthcare Provider of the Year. And it is my I and my colleagues look forward to
Okay, thank you very
reimbursement
much.
aligning with that recognition.
Thank you
so much.
Congratulations. Okay, next up, anybody else wishing to testify on SB 324? Members, any questions? Seeing none, moving on. SB 450 relating to autism. First up, Director of Human Services providing comments.
Aloha, Chair. On behalf of the Department of Human Services, we stand on our written testimony. We are also requesting support for executive budget requests and amendments.
Appropriations, yes, I saw. Thank you. Hawaii Disability Rights Center in support. Thank you. Ho'omau Therapy in support. G. Yasuda, are you present? Okay, seeing none. Kristen Koba Burt Bayada in support. Kristen, are you present on Zoom?
Thank you, Chair. We'll stand on our written testimony and support.
Thank you very much. Hawaii Association of Behavioral Analysts in support.
Hi, Chair. Thank you so much. Yes, I stand by our written testimony.
Okay, and your name is?
Dr. Maria Cholich.
For Hawaii Association of Behavior Analysts. Thank you.
Yes, thank you.
Catherine Wilson, ABA Positive Support Services in support. Alex Sampson, Maui Behavioral Therapy in support. Vitality ABA LLC in support. Amy Ola in support. Council of Autism Service Providers in support. Ho'omau Autism Services in support. Behavioral and Therapeutic Services of Hawaii in support. Golden Rule ABA in support. Hawaii Association of Behavior Analysts support. Balance ABA Inc. in support. And we've got approximately 42 other people all in support, individual support. Anybody else wishing to testify on SB 450? Members, any questions? Seeing none, moving on. SB 451 relating to persons with disabilities. First up, we have Director Yamane, Department of Human Services, providing comments.
We stand on our written testimony. Offering comments. Thank you.
Thank you very much. Hawaii State Council on Developmental Disabilities in support. Daintree Okay, Shay,
Sorry, you're stuck with me.
it's okay. Got 1 minute.
Aloha, Chair, committee members. My name is Chase Silver with the Hawaii State Council on Developmental Disabilities. I'm here for my boss, Daintree Bartoltis. She apologizes she couldn't be here today. We just are going to stand on our written testimony in support, but we just wanted to highlight that we've had a few individuals with intellectual and developmental disabilities come to us who are on the cusp of basically, even with Ticket to Work programs, not being able to qualify for Medicaid. These are individuals that are medically fragile and medical needy, and they're not going to just be able to survive off of typical insurance. We've worked for the last 3 decades to try to encourage our IDD population to work and do things like that, and we just think this would help with that, as we believe more and more people will use Ticket to Work programs and probably out-qualify Medicaid. Thank you.
Thank you very much. Next, we have Kirby Shaw providing late testimony of DCAB in support. Louis Urchik, Hawaii Disability Rights Center in support.
Thank you, Senator. Senator, I'm sure you recall a couple of years ago when we passed the Medicaid buy-in day. It was a celebratory day. I still have the picture. You, me, Shay, Daintree. There was a lot of promise and hope at the time that we did that. Unfortunately, we haven't all lived happily ever after with the program. There's been problems, so we wanted to bring it to your attention. I have Katie Meyer here, who's our staff attorney, who's actually handled some of the clients, some of whom I think were referred by the DD Council, and so she can, during the Q&A, if you have questions, she can probably give you more specifics. But the bottom line is that people have been getting kicked off when they shouldn't be getting kicked off. And so the program is not working. And by the way, I think your idea of the bill of going to a full buy-in program is what we always wanted to do. So, I mean, certainly if the legislature wants to do that, we're in strong support. But at the very least, I would love to see the legislature take a look at what's going on over at DHS and try to get things together in terms of properly implementing the buy-in program. So thank you. I appreciate your comment.
Okay, thank you very much. Next, we have Janelle Fiesta in support. Anybody else wishing to testify on SB 451? Seeing none, members, any questions? So I do. Come on up, Judy Moore Peterson. So I remember passing, that was back on when I was a House chair, the first buy-in program. And at that time, you had specific amounts that you felt were needed appropriations for. And it appears that no one is really being able, do you have any statistics as to whether or not anybody bought in based upon the first bill?
The bill that passed, that
Yes.
went through, was not a true buy-in in the sense that we chose in the implementation to not implement the buying in part, the paying of premiums part on a regular basis, because it is very administratively, there's a lot of overhead and it's administratively complex to operate a buy-in program. So how we implemented the Ticket to Work was by doing what's known as income disregards. In other words, saying, okay, we're just going to disregard your income up to a certain amount that brings your net income down to a certain level that has you qualify for Medicaid. We have fewer than 10 people currently who have signed up. I became aware that some individuals through administrative processes are having challenges on staying on. So that's an administrative thing to try to work through. But we also understand that for individuals who have more assets or higher incomes, they're not going to qualify. And if you want that sort of program, then indeed we will need to, we'll do an estimate of how many additional people, what those costs would be, both to operate as well as the programmatic costs. My recollection, and this is going back decades before I was here, because this program, people have been talking about implementing a program like this. It's in the tens of millions of dollars to provide coverage. But that being said, we're happy to bring back the numbers.
Okay. Why is it that the income disregard didn't work?
Well, I think that's a matter of opinion.
People.
Lou and I were having a conversation about this on the rail before we came in, and I was like, well, you know, it's like we can work through how to resolve the whatever administrative issues are once we're aware of them. And now that we're aware of them, I think part of it is, you know, when we were in the pandemic, we weren't doing regular renewals for individuals. I don't know why people are not signing up, but I think there are ways that we can improve and streamline our processes that would encourage people to sign up for the current program. It's not going to address those the situation in which people are earning more than that.
Well, it sounds like it's just an administrative, because they are going to be buying in. They are going to be paying premiums.
If they pay premiums, then
Right,
we would need to readjust the program that we have.
Right, so they will be paying premiums, so it's just an administrative cost, it sounds like.
Well, it would be administrative, but they're not paying the full cost.
Okay,
Yeah.
okay, so
So it's on a sliding scale,
I'm
et cetera.
thinking about passing this because there's really no opposition, but I understand that you folks haven't really figured out how much it's gonna cost you.
Right.
So I'm thinking about the delayed implementation and a defective date to give you folks time to figure out what you folks need.
Okay.
At least to keep the conversation going, because 10 people is not what we expected at the time when we first passed
I
this.
think
With
when
all
we
the-
first, yeah.
With all that hoopla.
Yeah, I think we had
3 or 4,
estimated
yeah.
like maybe about 100, and so, but I think we'll take a look. All
Okay,
right.
thank you very
Thank you.
much. Okay, any other questions? Seeing none, okay, moving on. SB 479, Hawaii Able Savings Program. First up, we have Deputy Attorney General providing comments. Ian Robertson.
Good afternoon, Ian Robertson, Deputy Attorney General. We submitted testimony providing comments, pointing out potential issues with the use of the term Hawaii Public School is used in the bill, and we've suggested some amendments.
Okay,
Thank you.
we saw that. Thank you. Okay, Hawaii State Council on Developmental Disability, Shay, and support.
Aloha, Chair. Chase Silver with the Hawaii State Council on Developmental Disabilities. We're going to stand on written testimony in support. We just wanted to highlight that ABLE accounts, a lot like the last conversation, is a really key piece to getting our population to be able to work, since it allows them to be able to save additional monies and still qualify for Medicaid, SNAP, HUD, SSI, and things like that. And so and specifically, it does identify that a staff would be given to our office, and the whole point is to get people on ABLE accounts. I believe there are over 200,000 people in Hawaii that would qualify. We have about 179 that currently have one. So it'd all be trying to get that number up. And that's only going to go higher.
Okay, thank you very much. Executive Office on Aging and Support, Carolyn, are you present? I see you on Zoom. Please proceed.
Yes. Good afternoon, Chair. Thank you so much. We'll stand on our testimony and support. Thank you.
Okay, thank you very much. Next is Luis Salavera, Department of Budget and Finance and Support. Hawaii Disability Rights Center and support. Okay, Kirby Shaw, DCAB and support. Kirby, are you present on Zoom?
Not present on Zoom, Chair.
Kylie in support. Anybody else wishing to testify on SB 479? Seeing none, members, any questions? SB 480, first up, Deputy AG, is relating to health. Providing comments.
Good afternoon, Chair, Vice Chair, members of the committee, Melissa Chi, Deputy Attorney General. We just make the recommendation that a better placement may be in HRS 481B.
Yes, I saw that. Thank you very much. Department of Health providing comments.
Aloha, Chair, Vice Chair, Senator Favela, Lauren Kim, Department of Health. The department isn't fully on board with this yet, but we are actively working with stakeholders and like Healthcare Association of Hawaii, Hawaii Primary Care Association, and the Department of the Attorney General. And we ask that this measure be moved forward to give us time to come to a compromise. But this is a very important issue It must be addressed, and it's a matter of how, and that's what we continue to negotiate. So we ask that this bill be passed out and keep moving. Thank you.
Thank you very much. Next up, we have Department of Health, again, providing comments. Melissa Lamb, DCCA Office of Consumer Protection, providing comments.
Good afternoon, Chair, Vice Chair, and committee members. My name is Melissa Enright. I'm with the DCCA Office of Consumer Protection. We just had a few comments in addition to our written testimony. OCP is responsible for reviewing, investigating, prosecuting allegations of UDAP's unfair, deceptive acts or practices as it relates to consumer transactions. Consumer transactions is defined in HRS 480-1 as those involving natural persons as opposed to legal persons, which could be private entities, businesses, corporations. Our concern here is that as written, this would involve OCP in business transactions between two private entities. Thank you.
Okay, thank you very much. Next, we have William Gu, Pharmaceutical Research and Manufacturers of America, in opposition.
Chair, Vice Chair, committee members. William Gu appearing on behalf of Pharma, which stands in its written testimony in opposition to the bill. I'd like to have a few comments. The first, foremost of which is that contrary to what the bill may imply, there is no issue regarding accessibility of 340B drugs to covered entities. I think due to the proliferation of contract pharmacies and the lack of transparency, some of Pharma's members are concerned that whether or not these pharmacy patients are actually entitled to get the 340B discount on drugs, which is why they're questioning some of the contract pharmacies. Also, there was previous testimony regarding the number of states that has taken action on this measure, and I think the previous testimony said over 20 states have taken some kind of action. Just like to add that a majority of these states, measures in states have not passed, and also that to our knowledge, there are 8 states that have considered this issue. 1 state has dismissed the claim. There's a stay on it because of.
Okay, we need you to wrap up. We do have your written testimony.
Okay. And the remaining 6 states are under litigation based on the federal preemption law. And then lastly, just wanted to add that there was some previous testimony about there being no cost to the state. There is a small cost.
Yes.
Thank you.
Thank you very much. Next, we have J.C. McCullough for Queens in support.
We'll stand our written testimony, strong support, Chair.
Thank you. Melissa Baumgarten, Hawaii Island Community Health Center in support. Melissa, are you present? Please proceed.
Yes,
You have 1 minute.
Yes, thank you. My name is Melissa Baumgartner. I'm the Director of Pharmacy Services at Hawaii Island Community Health Center. Thank you for the opportunity to testify today. I stand in my written testimony. I have only one comment to add, and that is to give a name to 340B. And I have 3 names for you: Amaris, Nadine, Lokelani. They are 3 patients who live with type 1 diabetes who cannot access insulin at contract pharmacies because there are no manufacturers who are willing to ship it to our contract pharmacies. So they can only get it at my one little pharmacy in KL right now. This is the reason why this bill is so important. It is for our patients to be able to get the medications they need to stay alive. That is all I have to say. Thank you so much.
Okay, thank you very much. Next, we have Ian Ross, Waianae Coast Comprehensive Health Center in support. Ian, you present. Please proceed.
Yes, Senator Chair, thank you very much. We stand on our written testimony for this measure. Thank you very much for this opportunity.
Okay, thank you very much. Next, we have Chevelle Davis, Hawaii Children's Action Network speaks in support. Chevelle. Thank you very much. Hilton Rethel, Healthcare Association of Hawaii in support.
Chair, thank you for the opportunity to testify. We strongly support this measure. This has material impacts each year for 15 hospitals in the state and FQHCs. We are currently losing, the hospitals are currently losing at least $30 million a year. We believe that we do need to keep this funding in the state. We are working closely with DOH and the AG's office on any potential amendments. We believe we can get this resolved very soon. We're making progress, and we thank you for the opportunity to testify.
Okay, thank you very much. Next, we have Michael Robinson, Hawaii Pacific Health in support. Then we have Aaron Rudick, Hep-Free Hawaii in support, William Ding, HDA, providing comments, Eric Abe, Hawaii Primary Care Association in support, Kumakahi Health and Wellness in support, Hawaii Health and Harm Reduction Center in support, Biotechnical Innovation Organization, Brian Warren in opposition. Brian, are you present? Please proceed. That doesn't look like Brian.
No, aloha, Madam
There's
Chair.
Brian. Excuse me, Nichols, it's Brian is next. Brian, please proceed.
Thank you, Madam Chair and members. Good afternoon. Brian Warren with the Biotechnology Innovation Organization. The 340B program has experienced exponential growth in recent years, yet has been primarily in areas that deviate from the program's original intent. Safety net clinics such as FQHCs make up only a small minority of the 340B program. Instead, hospitals and for-profit pharmacies have found out how to game the system by expanding into wealthy neighborhoods. However, adding more contract pharmacies has an increased patient access, as all this has done is allow hospitals and pharmacies gaming the system to expand more. Patients can get their medications at any pharmacy they want. An analysis of 340B claims from 2022 found that as few as 1.4% of patients at contract pharmacies saw even a portion of the 340B discount. And while proponents say that 340B costs taxpayers no money, that's not true because Medicaid that dispenses 340B drugs, the state does not get a Medicaid rebate. State employee health plans are paying extra money for all of this. And it's also not true that manufacturers are cutting 340B. All right, thank you, Madam Chair. We're just not cutting 340B. We have programs that are focused on hospitals.
Okay, thank you very much.
Thank you.
Nichols, your turn. Hawaii Health and Harm Reduction in support. I saw you on Zoom.
Yeah, aloha, Madam. Okay, aloha.
Yeah, and I'm sorry to bypass you, but
No,
we did
that's
not see
fine.
that you registered.
It's a packed agenda. Nikos Leverins on behalf of Hawaii Health and Harm Reduction Center in strong support of this bill. This is really necessary for the health and well-being of our clients and those that we serve.
Okay.
Mahalo.
Okay, thank you very much. Let me finish this one and then we're gonna do a recess for decision making. Next, we have about 7 other people, all individuals, all in support. 5 Minute Pharmacy in support, Veronica Sawyer, Alliance for Safe Biologic Medicines, providing comments. Anybody else wishing to testify on SB 480? Members?
In support.
Thank you very much, Jacqueline. Anybody else wishing to testify on SB 480? Okay, at this time, we're gonna recess because I have to be next door for Waterland and we will be back. Okay, thank you. Recess. Okay, recalling the 120 calendar. I went on recess too early. So next up, 120 calendar continuing on, SB 481.
Sure. I was at 480, yeah.
Okay, 480. Members, any questions for
The
480?
guy Brian?
Brian, are you still present on Zoom? Brian? Okay, I apologize. I thought we had no
Not
question.
present on Zoom, Chair.
Yeah, okay, who else was, William Gu, come on up.
Yeah, the question I had was basically because what Brian had said, but maybe you can answer him. He said the availability for medication is available at every pharmacy and certain discounts that we're talking about is available at every pharmacy. How accurate is what he had said, that what he said, if you're thinking is true?
I think that as far as the availability of the drug is concerned, again, you know, there's no question about accessibility to the discounted drug at the contract or the covered entities. However, when it gets to the pharmacy, a lot of times there's no issue at that point about whether or not there's a 340B qualification of the patient. So that's what the manufacturers are concerned. In other words, are these patients actually entitled to the 340B discount. And I think that that may come up only after there's where the drugs dispense, but then there's a question about reimbursement. So that's when the issue arises.
The only reason why I bring this up, I know particularly certain drugs that is high in demand. Give you 3 months supply, used to be $25 with the discounts, and now 1 month supply is $25. So those are the things that we concern, because certain people that need the medication, like that lady said about the insulin, is the same drugs we're talking about for people that is diabetic and need these medicines. If I have one price change from $25 for 3 months, now you're going from $25 a month. So those are the things that I guess is concerning, and why I guess a lot of people is supporting this bill, and that's why I do too.
I understand.
Thank you, Chair.
Okay,
Appreciate
thank
it.
you very much. Any other question on SB 480? Okay, moving on. SB 481, relating to community service licenses. First up, Board of Dentistry providing comments. Thank you. Hawaii Dental Association, opposition. Okay.
Aloha, my name's Melissa Pavlicek. I'm here today on behalf of the Hawaii Dental Association. Patient safety is our #1, and we appreciate the intent of this measure. We respectfully oppose it. We've supported in the past efforts to increase the number of dentists that can serve in community service or public health settings, but equating their service there to the equivalency of licensure bypasses some important restrictions that we have in our state for patient safety. This is why we oppose this measure in its current form.
Okay, thank you very much. Okay, next up, we have Patrick Donnelly, Hawaii Oral Health Coalition, Hawaii Public Health Institute in opposition. Patrick Donnelly, please proceed.
Thank you, Chair. Aloha, Chair, Vice Chair, and members of the committee. Patrick Donnelly with Hawaii Oral Health Coalition and Hawaii Public Health Institute. We'll stand on our written testimony, again, appreciating the intent, but in opposition to the specific ideas that are explained in it. Thank you for the opportunity.
Okay, thank you very much. Next, we have Hawaii Provider Shortage Crisis Task Force in support. Craig Haruki, DDS, in opposition. Hawaii Children Action Network speaks in opposition. I already said Hawaii Dental Association in opposition. Joseph Meyer, I see you present in support. Please come on up.
Thank you.
Identify yourself again and proceed.
Dr. Joe Mayer. This bill is more than improving access to MedQuest dental care, and it's also about the dental board's advocacy for MedQuest patients, or the lack thereof. 90% of my written testimony is the documentation of my remarks for the fact checkers on your staff. The board appears more focused on protecting the status quo than addressing our public health crisis. The board effectively blocked Canadian candidates from obtaining community service licenses through rewording the Bill 162 and 23. They initially denied a high-qualified dentist from participating in the school sealant program. They have shown no engagement with the critical public measures like water fluoridation bills or sugar beverages. 9 states issue an unrestricted dental license to Canadian dentists. The community service dental license is a restricted license targeted at MedQuest patients requiring 3 years of clinical experience. I ask that this bill be amended to add the venue Department of Corrections facilities. I have full faith and confidence in the committee, the Commerce Committee, and the legislature to do the right thing. My faith in the dental board, based on their past actions, not so much.
Okay, thank you very much, Dr. Meyer. Okay, next we have Derek Ichimura in opposition, Robert Besa in opposition, Russell Kim in support, Nancy Partica in support, Hawaii Dental Association again in opposition, Donald Sand in support, Mendel Sato in opposition, Penelope Dodson in support, Eric Hasegawa in opposition. Anybody else wishing to testify on SB 481? Members, any questions? Okay, moving on. SB 482, relating to cognitive assessments. First up, we have Department of Health in support.
Yes, the department stands right.
Okay, next, Executive Office on Aging, providing comments. Carolyn, please proceed, you have 1 minute.
Thank you, Senator. Caroline Cuddy-Rao, Executive Office on Aging. And I just wanted to highlight, we're in support of this measure, the intent, but we're offering comments. My apologies. This bill is mandating healthcare providers to provide the cognitive assessment, and it also, the way the bill is written, will require HIPAA compliance. So our recommendations in our testimony is to amend the bill to offer it instead of mandating the cognitive assessments. We also wanted to ask that we strike the age of 65, and you'll hear later probably from DD Council on that. And we also wanted to create a pilot project to demonstrate the viability for a statewide program and ask for flexibility in the data elements. And we actually submitted with our testimony some language changes to the bill itself for clarity. So, and I'm available for any questions. Thank you.
Thank you very much. Hawaii State Council on Developmental Disabilities and Support.
Aloha Chair Chase Over with the Hawaii State Council on Developmental Disabilities. We'll stand on our written testimony and support. Also, our testimony is offering an amendment, and the intent is, as Caroline has mentioned, is to just reduce the age or get rid of the age. Thank you.
Get rid of the age. Thank you very much. Jack Lewin in support for Hawaii State Health Planning and Development Agency. Oh, he left. Kobe Chalk, Alzheimer's Association in support.
Hi, Chair Sanvan Ventura, members of the committee. I'm Kobe Chalk with the Alzheimer's Association. We're in support of this measure. We'd just like to highlight a few of the amendments in our testimony. We want to keep the shall administer on page 6, lines 4 through 17. So we want to make sure that it is a mandated cognitive assessment test. We do defer to EOA on the data component on page 6, starting on line 18 on, to make sure we're in HIPAA compliance and can start that pilot program so that there's good continuity between what's currently happening as well as other practices that could be happening in terms of data collection and analysis. And in drafting, there was an error, and we intended to include Medicare Part B as well as Part C. Medicare Part B, of course, being the public side, and Medicare Part C being the private insurers. It's the same exact visit, but with Part C, that's about half of the population in Hawaii that we are missing currently in the bill.
Okay.
Thank you.
So I just want to point out the written testimony we have says you are strong support of this bill being passed without amendments. So you are changing your mind now.
Apologies. Yes, there was a change in that.
Okay.
Yeah.
Why don't, and I know you were trying to submit it early on to my committee earlier, but do you have copies of those proposed amendments? Because the one we have says strong support without.
Yes, I
on
have
page 482.
Yes.
So, okay, provide the written testimony. Okay, we need to submit this for late testimony, amendment of Alzheimer's. And I understand Waterland is ready to gavel in. Okay, but not until we're done. Okay. Next up, we have Hilton Raythel, Healthcare Association of Hawaii, providing comments. AARP in support. Are you present, Audrey?
Yes. Good afternoon. Audrey Suga-Nakagawa from AARP. We stand in our position in support, and we defer to the Executive Office on Aging and the Alzheimer's Association with their amendments.
Okay, thank you. Hawaii Disability Rights Center in support. Hawaii Primary Care Association in support. PABEA in support. Hawaii Public Health Association in support. Alzheimer's caregiving and the caregivers in support. Hawaii Pacific Health providing comments. And we have 15 other individuals all in support. Peter Black, are you present on Zoom? Peter Black, please proceed. You have 1 minute.
Yes, I'm here. Okay. So I'm a retired professor, and I had an early diagnosis of mild cognitive impairment. And that was a big surprise to me. But what it did was give my wife and I some time and to get our families on board, to redo our ideas about the future, and to make accommodations to make the development of Alzheimer's in my brain as positive as possible, which is not very positive. So I submitted a document, and I strongly encourage, if possible, this bill becomes law. Thank you very much.
Thank you very much. Thank you very much, Mr. Black. Anybody else wishing to testify on SB 482?
Good afternoon, Chair, Vice Chair, and members of the committee. My name is Gino Sequena, here in my role as a board member for the Alzheimer's Association of Hawaii, in strong support with the Alzheimer's Association's amendments. Thank you.
Okay, thank you very much. Anybody else wishing to testify on SB 482? Members, any questions? Okay, now we're going to do a recess to meet with Waterland and then coming back for the 120 calendar after the Waterland Joint Committee. We are in recess. So recalling the 120 calendar for Health and Human Services, I've been informed that we don't have enough time to finish this calendar. We are going to defer the rest of the calendar to Wednesday at 1 p.m. to 5. For the ones that I'm going to defer, can I just announce it? For the ones I heard. I can do that. Yeah, okay. Yeah. Okay. Right, okay. So for those, for the rest of the bills, which is SB 483, SB 710, SB 712, SB 950, SB 952, SB 954, SB 956, 957, 959, and 1609. No further written testimony will be accepted, but we will be having the oral testimony on Wednesday at 1 p.m. As to those bills that we have already heard, we will be, where's my decision-making notes? There are certain bills that we will be deferring. And that would be for SB 323. Chair's recommendation is to defer that indefinitely. There are still problems with that bill, and we'll try it again. For SB 324, Chair's recommendation is to defer that also indefinitely. SB 1245, which was identical, had previously passed. For SB 480, regarding 340B, since the House Companion is moving, we're also going to be deferring that. For SB 481, community licenses, that needs work and probably a reciprocal agreement with Canada. So we're going to defer that indefinitely and work on it in the interim with the stakeholders. For SB 482, for cognitive assessments, we're also going to defer that indefinitely because the House Companion is moving. Same thing with SB 483, House Companion is moving, so we're deferring that. SB 712, House Companion is moving, so we're deferring that. SB 950, we're going to defer that in lieu of SB 1398. And SB 956, we're going to defer that because HB 951 is moving. SB 959, we're also going to defer that because House Companion is moving. And the rest, we are going to defer decision-making to Wednesday at 1 p.m. in this room 225. Wednesday, what day is that? February 12th. February 12th at 1 p.m., room 225. And with that, we are adjourned for the 120 calendar. Thank you, folks, for your patience.